It's a new staffing mandate, so it requires nursing homes across the country to hire more nursing staff.
That mandate passed by the Biden administration Monday is meant to improve patient care, but as 12 News reporter Gabriela Hernandez explains, it has some nursing home facilities concerned about sustainability.
Only about 25% of the nursing facilities,
nursing homes like McPherson Health and Rehab, sharing its opinion
would be able to meet the staffing mandate today.
About meeting a new federal staffing mandate.
We are in full support of stronger staffing numbers, levels. However, the way that the mandate is requiring the staffing is extremely difficult. You're also competing against, like I said, hospitals, doctors' offices, hospice companies, home health agencies.
Nursing homes will need to provide patients with more than half an hour of care from a registered nurse per day, almost 3 hours of care from a nurse aide, and require a registered nurse on site 24 hours a day.
The mandate aims to bring better inpatient care to nursing homes and long-term care facilities across the nation.
To meet those requirements, Courtney Wolf with Presbyterian Manor says they're getting creative with how they recruit.
The first and probably most important strategy is to identify staff that are already working for us, who are doing a great job for our residents, and helping them to achieve that future certification or licensure. It is a challenge, and especially in more rural settings.
A lot of facilities wouldn't be able to sustain and could end up closing eventually, because they aren't able to support the mandate.
Most nursing homes across the country will have 3 years, while rural community nursing homes will have 5 years to meet these requirements. In Kansas, Gabriela Hernandez, 12 News.
Centers for Medicare and Medicaid Services say that the average nursing home has around 100 residents, meaning an estimated 2 registered nurses each day and at least 10 or 11 nurses aides.
All right, heads up.